If you are a mom that's planning to have a planned C-section, this video is for you. If you are an auntie that has a sister or anybody, if you know anybody that has a scheduled cesarean session, this video is for you. There are 5 things you should be telling your doctor to do on you to help with your recovery and will help with afterbirth and making your experience and advocating for yourself, making your experience so much better. Let's go. Welcome to Nadine's Life Diary. If this is your first time seeing my face, my name is Nadine Quanta. Thank you for coming in the room. This is a channel that I created to make sure that you feel seen, feel heard, feel advocated. I'm just here to validate that feeling, that thought, and I'm just a mom that is actually living her dreams. So come along, share, subscribe, comment. I'm here to build a community, right? I'm here to stay. I'm here to build a community, like connect with people, advocate for people. It's not just something I want to do. It's a lifestyle for me because that's my person. So without further ado, let's dive into it. First, I'm going to start by saying that motherhood is a very beautiful thing. It can be very confusing because you have a lot of mixed feelings, right? But whatever route you are choosing to become a mother, kudos to you. If you want to you're getting a vaginal birth, kudos to you. If you're getting a cesarean session, kudos to you. I don't even know. There's this argument that people always have. To me, I'm going to call them ignorant people. Always have that. If you give birth through a cesarean session, you choose the easier path. Do you know what it means to go through surgery to birth a child? Okay, I'm going to leave that as that. So I'm going to say it again. If you whatever route, right now it's 2024, and there's IVF, there's getting surrogacy, whatever routes you choose to be a mother, kudos to you, congratulations to you. Children are a blessing from God. I truly believe that. I'm living in that. And in this video, I'm going to be sharing 5 things that are going to make your recovery better. So if you know anyone that this information is going to help their recovery better, please send it to them, okay? First one is going to be tell your doctor. When you go in first to see your doctor, please be prepared, because to them, it might just be one patient. It might just be another shift. But to you, this is your life. So the way you prepare for it is either going to make or mar your experience, your recovery, and your story. Just see that you're writing your own story. So the first one is going to be tell your doctor to do a double layer, to close you up with double layers, 2 layers. Why they don't like doing this? Because it takes them more time, but that's your job and that's what you want to do. Make sure you specify it. And side note, when you go into a doctor's office, every single thing you say is either recorded or they're typing. They're going to type that in their notes. So you have that on record. So tell them to do a double layer closure on you and come and thank me later. Okay? The second thing you're going to tell them to do is to close your abdominal muscle. It's like having a built-in tummy tuck. Close your abdominal muscle. And I'm going to put this again as a side note. If you feel you're not being heard, if you feel that your spirit is not aligning, there's a reason why there's called instinct. There's a word called instinct. If you feel like you're not aligning with your doctor, please do what you have to do. Okay? The third one is going to be close your fat layer. Closing your fat layer. That's the third one you're going to tell them to do. They are the professionals. They're going to explain to you. You can do your own Google research, your own little research on the site, and see what that means. When you go in, you're going to tell them that, and they're going to explain to you. You have the right to tell them to explain to you how they're going to do that, just to make sure that they understand what you want them to do. I'm going to put this disclosure here because we're in 2024 once again. I am neither a licensed professional or a doctor or anything. I'm just a mom that is advising other mothers to make their life a little bit better, right? So that's a disclosure. Whatever you do with this video, it does not attach to me. I do not tell you to do it, but I'm what's it called? I'm putting it in this information. I'm sharing information to advocate, to educate, to make our life better, and for you to be able to get a better experience. So yeah, now that we have that out of the way, the third thing we're going to talk about, or you're going to tell them to do, is to close your skin with sutures, not staples. Sutures, not staples. The fact that the person is your doctor and they come in, oh hi, and some of them are lazy, some of them do a rush job, and you can't be a rush job because that's your life, right? What they do on your body, you are the one that are going to feel the consequences. You are the one that's going to feel the pain. They are the one that's going to go through the longer route of recovery. So yeah, you want to tell them that you don't want staples. Make sure you emphasize that. So you have that on record. So if the person still goes through with that, you can actually sue them for that. But I promise you, if you say these things, the doctor will know you know one because you stand out because they are so used to getting a lot of people come in and just go with the flow. I mean, you're pregnant sometimes you don't even have time to think for yourself and the hormones are all over the place. You're like, okay, let's just get this over with. And the last thing I think, what's it called? I'm going to talk about here is to tell them to run an additional bag of pitocin to decrease your risk of bleeding. God forbid, we are not praying for anything to happen to you. We're not praying for any bleeding or any complications. But this extra step of running an extra bag of pitocin is going to help reduce your risk of bleeding. So you see, you walked into the doctor's office and you told them what you wanted to do like a boss because they're there to do, they're there to work for you and not the other way around. You're there to advocate for yourself. And if you are a spouse that has that go into this appointment with your spouse and you feel like your spouse is not good at advocating for themselves, please speak up. Or if both of you are not able to do that, put it in writing. Send a mail. That's even better because you have a trail that it was said and request for an acknowledgement, right? I'm going to crown this all also to say that advocating for yourself is like you going into a courtroom for yourself. Getting a CS is no joke. It's no joke. It's life threatening. There's a reason why they call it is life threatening. And the last thing I'm going to say is that if for any reason during your prior to you getting this getting your session, you have any when I mean any inconvenience, because it doesn't necessarily have to be pain yet. You have any inconvenience, shortness of breath, you get tired easily, you feel like your mouth is getting dry, anything, your what's it called? Your hormones are all over the place. Please speak up. Speak up, speak up. It might be just something else. And if you feel you are talking but the person is not listening, please, 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 I'm gonna say you should do this. Ask the doctor, what is your differential diagnosis of this thing I'm feeling? Let's say, for example, during my pregnancy, I used to get tired a lot. Like if you speak to me on the phone, you're gonna think I just ran up a flight of stairs because I was breathing it really hard. Like this is how I was sounding. So if you have something as much as that, it's very easy to brush it off. Oh, it's one of those things that come with pregnancy. Just speak up. Say it, let the person rule it out. Let your doctor rule it out. Ask for a differential diagnosis. Ask them what could it be. When you say that word first, differential diagnosis, it's going to catch them off guard because they know what it is. They're going to try to rule it out, especially if you have a doctor that when you come in, they don't start they don't validate your feeling, because when you go into the doctor's office and they start running tests on you, it validates the feeling that you came to the hospital or something. But when you come and they just like, oh, it's going to go away, don't worry about it, and you leave, that thing was not, at least the test was not done to find out what the cause is, you don't feel validated. So ask them, what is the differential diagnosis you have for this chest pain, for this shortness of breath, for this dry tongue? How did you rule it out? How did you rule the thing in and out? I promise you, when you say those things, they're going to find a way. They're going to start running all those tests. They're going to start running all those tests that you need to have. So yeah, with these few points of mine, I really hope that I have empowered you to not feel overwhelmed. I'm going to start by saying congratulations, be it a scheduled cesarean session or being a planned one, or you did it willingly. Ask the reason why you're getting it, and when you agree with the reason why, list out these things to your doctor, so that you're entering into that room feeling prepared, feeling heard, feeling advocated for, and you know what you're getting, and it's going to help your recovery better. Right now, every mom wants to be the snatch mom and all that. All these things are going to help your recovery better, because it's even harder as a cesarean mom to snap back. So why not just do a little thing that is a little bit easier to get your route to be shorter? So with these few points of mine again, I hope that I made your cesarean session better. And if you have any questions, if you have any views, you can comment, like, subscribe to my channel, and I'll see you next week. You have a new video every weekend. Every weekend on this channel, we get a new video. Thank you, and see you in my next video. Bye bye.